respiratory system and how to examine the chest. أنت بالبداية بالنسبة للجنرال examination يعني كنا ختمه أكيد بصف ثالث.
دكتور إذا تسمح لي، بالنسبة للجنرال نحن كلش ضعيفين بينه بصراحة، لأنه أخذناه يعني البعض أخذوا والبعض أيضا ما أخذوا وما أخذناه عام، يعني أكيد سريري لأنه صارت هاي مشاكل مال المظاهرات وكورونا أدرى بها يعني بشكل عام نحن ضعيفين بينه الجنرال.
بلى هو أنت إن شاء الله راح تاخذون يعني خلينا نقول أحد السيشنات عن الجنرال examination يعني خلال الكورس، بس لأنه عندنا أشياء خلينا نقول in the respiratory system can be manifested in the general examination يعني not only in the chest. فراح إن شاء الله إحنا راح ناخذ local examination of the chest، وبعدين إن شاء الله راح نجي نذكر بعض الأشياء اللي related to the general examination، وراح تنعاد إن شاء الله بالسيشنات اللاحقة. عندنا أكثر من سيشن على ال respiratory system، عندنا السيشن اللاحق على الكيسز، فإن شاء الله حتى هي تغطي هاي الأمور. اليوم إن شاء الله إحنا راح نناقش mostly the local examination of the chest. أو يشمل ال respiratory system examination، يشمل ال general examination and local examination of the chest. Regarding the general examination راح أذكر لكم بعض الأشياء يعني ولو يعني ما إنه حيسوي حساب مع الصور، بس راح نذكر الأشياء حتى إن شاء الله ما قلت لك لما نعيد تكون هذه أش قد تنعاد أش قد أفضل. But when you start examining a patient, mostly it will be in the inpatient setting، يعني patient موجود بالمستشفى أصلا. You will start to take a look on the patient. طبعا first of all you will introduce yourself to the patient, greet the patient, take the permission from him or her. The purpose of this is not just an ethical issue. From the response of the patient to you, you can get a rough estimate about the consciousness of the patient, level of consciousness I mean, and whether the patient is dyspneic or not. أنتم أكيد كنتم انتبهتوا ملاحظتم إذا البيشنت يعني يكون عنده يعني ضيق نفس، حتى الكلام ماله يكون يعني خلينا نقول ما سهل ويبين علينا. حتى واحدة من الكرايتيريا of patient who is يعني severely dyspneic or in respiratory distress نقول he cannot complete a sentence، يعني ما يقدر يكمل الجملة. فهذا الغاية إنه من ناخذ البرميشن من البيشنت، ممكن يعني بهالشورت conversation هذا حصلنا في estimate على level of consciousness، وكذلك على whether he is in respiratory distress or not. But after we take the permission from the patient and we will start to take a look on the patient, general look. هاي عادة وتحاولون هاي general look تاخذوها هكذا يعني خلينا نقول ما أنه تقضون بها كثير وقت طويل. أنا بهاي general look on the patient I will try to see whether the patient looks طبعا يعني في looks dyspneic أشون راح يبين عندي، راح يبين من ال effort of breathing، بين من ال respiratory rate. يعني أنا عارف normal إنه respiratory rate هو 14 to 18 breath per minute. A patient who is breathing more than that نقول عنه he is tachypneic. لذلك إنه أشوف بالنسبة يعني regarding the face ممكن أشوف whether he is cyanosed، وهاي بين من ال lips. زين، فcyanosis also it's an indication of respiratory distress. Also I can notice whether the patient is using accessory muscles of breathing. عادة البيشنت لما يكون in the bed and you are looking at him, يعني you can see at least the neck. Okay, the patient who is using accessory muscles of breathing, like the neck muscles, this also indicates that he is in a state of respiratory distress. And other things that you may notice, can notice that if the patient is connected to a device like a nebulizer, جهاز تبخير, or there is an oxygen bottle beside the patient, and I mean the indication on the patient is in need for oxygen, or he is already connected to an oxygen bottle via either nasal cannula or oxygen mask, or you may face a patient who is in the respiratory care unit where there is a ventilator beside the patient, and the patient usually is intubated with an endotracheal tube to access to have access to the respiratory system. وهاي يعني عادة الجنرال لوك ممكن هم تنطيني كلو، يعني حتى إذا كان أنا الأوردر اللي جاني مثلا بالامتحان اللي examine the chest of the patient ما قال لي the respiratory system. لو قال respiratory system لازم أبحث general and then local examination of the chest. بس حتى لو كان القصد أنه كان الأوردر أنه examine the chest local يعني exam، بهل short period ما قلنا when you breathe the patient ممكن أنه تأخذونها يعني فكرة عن الأشياء اللي قلناها، يعني whether he can complete a sentence or not, cyanosis if there is a use of accessory muscles like the neck muscles, and also about the surrounding of the patient. قلنا إذا كان أي جهاز تبخير oxygen زين. We will start local examination of the patient. قلنا أنه great and Arthur mission. Reclining at 45 degrees to the bed with his chest bare. يعني لازم يكون the head is raised for 45 درجة with his chest bare، يعني should expose his or her chest. You should observe from the end of the bed. عادة أول من نعمل exposure of the chest, we stand at the end of the bed. At the end of the bed, you might be able to notice the shape of the chest and also the symmetry of the movement of the chest. This is an important point. We will discuss it later on. So, from the general appearance, you cannot, if there is any evidence of weight loss, يعني patient who is obviously underweight, cachexic. This might be related to the respiratory system or might be due to another cause. Of the causes that might be related to the respiratory system, which causes comes in your mind? Okay, من عنده
دكتور كوبت
يعني advanced cough، يعني which type؟ زين، انت عندك الكوبت، ايش الموست common cause of cough؟ smoking، ما صح؟
نعم.
بالنسبة للsmoking, it's a risk factor for which other disease in the lung?
Unmuted.
Bronchocarcinoma.
Bronchogenic carcinoma.
Muted.
bronchogenic CA ممكن انه يهاز يعني كاجكسيا. ذلك انه اكيد سمعتم او جزء ما كان صادف انه كنت شفتم patient with TB. Okay, pulmonary tuberculosis. Again, they are underweight. وكذلك patients with bronchiectasis. Okay, these might be causes of underweight or cachexia that's related to the respiratory system. you can notice also whether the patient is breathless at rest. Some patients regarding their dyspnea, they report that their dyspnea is only by doing an effort. مثلا يقول لك امشي مثلا الى راس الشارع، او اللي يكون more severe يقول مثلا امشي داخل البيت، اروح للمطبخ، اروح للحمام، اشعر بضيق نفس. اكو some people have dyspnea at more severe level when they do a very simple effort like dressing and undressing. يعني ممكن بالحركة اللي تقول له عليها انه بس يعني افتح قميصك او طلع صدرك، ممكن بهالإفورت البسيط ممكن يعني تزيد الديسنيا عنده. or sometimes patient is breathless even at rest. يعني هو مدد كل شيء ما يعمل تشوف انه he is dyspneic. قلنا اكو other thing اللي حكيناه، قلنا central cyanosis، نشوف the lips are bluish in color. اكو other thing in the lip that you might notice will be a purses his lip، اسمه pursed lip breathing. ما أعتقد كن شفت ما in a patient، إن شاء الله المرة أنزل لكم عليها فيديو. Patient who have especially the chronic obstructive pulmonary disease. أنتم تعرفون إنه بالنسبة لل obstructive airway diseases in general they affect the expiration more than affecting the inspiration. أعتقد كن أخذت معي بالمحاضرة. أخذت المحاضرة مع ال COPD.
أي دكتور عم الأول أخذنا؟
لا هسه بالرابع.
أي يمكن ما أخذنا.
لا يعني المفروض هي من البداية أكيد. فالobstructive airway diseases usually affect the expiration more than affecting the inspiration. ولهذا السبب أنه لما يصير عندنا failure of expiration، يعني not all the air that has entered in inspiration will come out at expiration because of the limitation in the airway, in the patency of the airway. ولهذا with time there is what's called hyperinflation. يعني دائما انه ما قيد فرغ كل الهواء يظل داخل اللنج. but with time hyperinflation of the lung. فليش؟ لأن during the expiration there will be a collapse of the airways، وراح يمنع لي انه the whole of the intake air to get out. The patient will adapt to this by doing what's called pursed lip breathing. يعني لما يتنفس يطلع الهواء بالexpiration راح يحاول يصغر فتحة الفم عنده، يعني إذا فتحة صغيرة كلش. pursed lip، البيرس هو الجزدان هذا أبو الشريط اللي واحد يسحبه ينسد الحلق معه. فهو يعني البيشنت راح يسد فمه فتحة كلش صغيرة. ليش؟ حتى لما يعمل الاكسبيريشن هسه إذا جربوها واحد يعني إذا يطلع الهواء ويكون كنسد ثم بس كان بقى فتحة صغيرة راح يحصر الهواء. هذا إيش الفكرة منه؟ to create an air splint، يعني إيش دعامة هوائية to the airways preventing their collapse during the expiration. هذا اسمه pursed lip breathing. ممكن هم ألاحظه when patient is يعني in front of you. هسه the other things that I will notice. هسه قلنا أهم شيء بس كريفيو سريع. قلنا greeting آخذ level of consciousness، أشوف he can complete a sentence or not. دحق على general appearance كcheck sick patient or average build or good body build. أشوف إذا كان أكو evidence of breathlessness، use of accessory muscles، central cyanosis، pursed lip breathing وهكذا. هسه I'm looking at the chest. I'm at the end of the bed and I'm looking at the chest. I will look for the chest movement with breathing and symmetry of movement. هون استخدم معناه بالإنسبكشن استخدم كلمة chest movement. Expansion ما استخدمها. Expansion is a step in the palpation. I will check for the chest movement with breathing. أشوف أنه هل أنه يتحرك الصدر عنده أثناء التنفس بشكل جيد إلا قليل. وما بس أنه أشوف الموفمنت in general. أشوف whether it's symmetrical or not. أشوف أنه هل both sides of the chest are moving in the same level. يعني مرات ممكن أشوف أنه patient there is a chest movement with breathing. لكن I can notice that there is a difference between the both sides of the chest. كذلك أنه I should notice for the shape of the chest. أنتم تعرفون the normal shape of the chest اللي هو إيش يكون عندي؟ يكون عندي هذا هو النورمال. يكون عندي the transverse diameter of the chest اللي هو هذا is more than the anteroposterior diameter اللي هو هذا ماشي بالسهم الأحمر. One of the abnormal shapes in the chest is this one. It's called barrel chest. مثل برميل. هذا هون إذا تلاحظون the transverse diameter of the chest is almost equal to the anteroposterior diameter. يصير مثل البرميل. This is one of the signs of hyperinflated chest. مثل اللي يصير عندنا in advanced COPD or other obstructive airway disease like bronchial asthma. So this is barrel chest. Also, I should notice for any marks or scars on the chest. There are many types of scars in the chest. There are many types of scars in the chest. The most common one to be noticed here, the midline of the sternotomy scar. Just مصادف إنه شايفين patient كان عمل يعني فت cardiac surgery like cabbage تبجيل شرايين or other. Usually they have a midline or a sternotomy scar. بس دقيقة. إن شاء الله خليكم صورة على scars of the chest تطلع هسه. كذلك أنه we might listen well to the breathing. Sometimes even before using the stethoscope you might be able to hear some abnormal sounds in the breathing. Like when you are examining the patient طبعا especially يعني if you are examining a patient in a quiet room طبعا اللي هو هذا لازم يكون شرط كل فقرات الفحص بس ما يتوفر عندنا بالمستشفى. You might be able to listen to audible wheezes. يعني ممكن مرات patient يعني أنتم واقفين تسمعون إنه there are wheezes. هذا it indicates طبعا severe bronchospasm. Usually we hear wheezes on examination of the chest by the stethoscope, but sometimes wheezes might be audible even without using the stethoscope. فلما أسمع هذا الويز لازم يعني أنا يعطيني فد impression أنه there is bronchospasm، وأنه بالأسكولتيشن لازم definitely لازم أسمع. كذلك أنه مرات ممكن you might hear other type of noisy breathing اللي هو السترايدر. سترايدر ما أعرف كان مر عليكم إلا لا. إحنا wheezes are mainly expiratory، بينما السترايدر it's an inspiratory noisy breath. عادة يصير عندي when there is an obstruction of the larynx or in the major airway like in the trachea. Usually hear it during the inspiration. تسمعون البيشنت يصير البريدنج ماله هكذا. هاي راح يعني ممكن انه تلاحظوها همين. ممكن اذا احد بيكم عنده اطفال بالبيت هذا ممكن مرات تصير عندهم. هذا يسمونه سترايدر. فهو هم one of the types of the noisy breathing يسمونه. Sometimes you can not hear wheezes, but sometimes you can notice by looking to the patient that his expiration is longer than his inspiration. احنا normal breathing عادة the inspiration is longer. لكن when there is a respiratory when there is an expiratory defect مثل قلنا the patient with obstructive airway disease, they will affect the expiration more. Patient try to prolong the phase of the expiration. So you can notice that patient is taking a breath, and on expiration there is a prolonged phase of expiration. We come to the right of the patient to complete our examination. And the other abnormalities that you can find on the chest, like this one. This is called pectus excavatum, or called funnel chest. funnel يعني هذا القمع. This type of abnormality, usually it can be associated with certain findings. You would expect on examining such a patient that the cardiac apex is displaced to the left. It's displaced to the left. Okay. And this finding might be an isolated finding or might be associated with other diseases, like sometimes in Marfan syndrome. So this is called funnel or pectus excavatum, which is a depression in the lower part of the sternum. It's depressed down. The other abnormality is this one, which is called pectus carinatum, which is called pigeon chest. These other things that might be related to the chest are due to deformities in the spine. You know, we have two types of deformities in the spine. We have the kyphosis, which is the anterior-posterior curvature of the spine, and we have the scoliosis, which is the lateral curvature of the spine. Or sometimes we may have a combined lesion of kyphoscoliosis. This will be reflected also on the shape of the chest from the front, because as you know, the ribs are connected to the vertebrae. So this may lead to an abnormality or an asymmetry in the shape of the chest. Sometimes you can notice when you are examining the patient, you can notice that you have this finding. you have the chest exposed and you are examining the patient, especially the patient who seems to be dyspneic, can see these depression in the intercostal spaces. These are called indrawing or recession or intercostal recession. This is indrawing of the chest muscles. شوفون انه الانتركوستال سبيسز كأنه تنشفط للداخل. هذا indicate indrawing of the chest muscles اللي هي it is a sign of the use of accessory muscles of breathing. هسه احنا اي واحد اذا يفحص normal subject شوف انه there is no such a finding in a patient who is not dyspneic or not in distress. Like when you face a patient who is severely dyspneic, you might notice that he is using accessory muscles of breathing. So you can notice that he is using neck muscles, the sternomastoid and platysma muscle, and also the intercostal muscles. So recession of intercostal muscles or indrawing of chest muscles. Right. Other thing that we might notice on the examination of the chest is that if we have dilated veins over the chest, dilated veins can be seen also over the chest. They will, and if it's distributed in the upper part of the chest and also involving the distension of the neck veins, this can be due to a syndrome called superior vena cava obstruction syndrome, or sometimes it's abbreviated as SVC, superior vena cava syndrome. And usually when there is obstruction to the superior vena cava, in most of cases it is due to a lung mass. Other causes of superior vena cava syndrome can be obstruction by an enlarged lymph node, which can occur in the setting of lymphoma. But the most important one is the lung masses. Regarding, we'll come back to the scars. بس إن شاء الله راح أبعث لكم بعدين صور اللي ما رغبت إنه تنزل على هذا الفايل. إحنا قلنا first type of scar is a midline or sternotomy scar اللي هي على هذا الخط من اسمه sternotomy يعني over the sternum. When you see such a scar, mainly the patient had a cardiac surgery. Could be due to replacement of a valve or coronary artery bypass grafting, تبديل شرايين, or sometimes it's a combined one. When you see a scar, when you see a scar in the midline or a sternotomy scar, you are allowed to ask the examiner that you would like to uncover the legs of the patient to look for another scar in the medial side of the leg, which is usually the site for the venous for the graft اللي هو احنا عادة بتبديل الشرايين منين ياخذون الجرافت؟ ياخذوها من الساعة الأسفلين واللي هو along the medial side of the leg. فإذا كان موجود sternotomy scar with a leg scar, this is mostly the surgery was coronary artery bypass graft. One type of scar, what's called the thoracotomy scar or the classical thoracotomy scar اللي ايش يسموه posterior lateral. أشوف السكار يجي من الباك along the lateral border of the chest على هذا الخط. فمن اسمه posterolateral thoracotomy يجي من يعني ال posterior aspect of the intercostal space along the lateral border و variable degree of extension into the anterior part. هذا المكان نشوف أكثر شيء over the lateral side. Presence of a thoracotomy scar or of a posterolateral thoracotomy scar, it indicates that the patient had a surgery either involving the lungs or the esophagus. Surgeries involving the lungs can be many. Like patient might have a previous lobectomy, which is resection of a complete lobe, or segmentectomy, a section of a segment, or surgery to resect an abscess or a tumor. Okay, so the access to the lungs is via posterolateral thoracotomy scar. Besides, مثل ما قلنا إنه the esophageal procedures are also carried out through a posterolateral thoracotomy scar. It's not from the front, because the esophagus is located in the posterior mediastinum. الأشياء اللي صار إنه يعني بس review. And from the end of the bed, I check the chest movement and symmetry of movement. Then I will come to the right and check the shape of the chest, any deformities in the chest, مثل ما قلنا هاي funnel chest, pigeon chest, deformities due to the spine, deformities like kyphosis or scoliosis or both, any marks and scars in the chest, and أمشي the midline or the sternotomy or the posterolateral thoracotomy scar. We should also notice for the direct veins over the chest. Other type of scar that you may see in the chest are sometimes you can see in this side, usually in the sides, whether the right or the left. A small scar, like 2 cm or even smaller. A scar like that, a small one, usually indicate that the patient had a chest tube inserted before. ما أعرف يمكن شفتم أنتم الchest tube بالحقيقة أو لا. بالطوارئ أكيد يعني ممكن لاحظتم إنه patient عنده chest tube. فعادة chest tube is inserted through a small incision in the chest. This is used chest tube either to in the treatment of sometimes pleural effusion, sometimes also in the treatment of pneumothorax, and sometimes post surgery. And after thoracotomy for any purpose, you should insert a chest tube. قلنا أهم شيء أنه from the end of the bed, check the movement of the chest with the breathing, whether it is symmetrical or not. And also we can comment also on the shape of the chest, whether it looks of an abnormal shape like the barrel chest. We come to the right side of the patient, look for any other deformity, like we said, the funnel. Look for any scar in the chest, for dilated veins over the chest. Okay. Besides, as we said, listen to the breathing, whether there is some abnormal. Now we come to the palpation. Palpation of the chest usually involve five things. First, to palpate for the trachea, and second for the expansion, and third is for the apex beat, and the fourth thing is for the lymph nodes, and last is the tactile vocal primitus. Whenever you reach the step of palpation of any part of the body or any system, you should ask the patient if he has any site of pain in order to avoid that site, or to palpate it gently. Because if you inflict a sharp pain to the patient, this will be annoying to him, and this might affect his cooperation in the examination. فقبل ما يعني نطخ المريض بإيمة، يعني خلينا نقول فحص كان، نسأله إذا عنده أي مكان بها ألم. Regarding the first aspect, which is the palpation of the trachea. In fact, for the trachea, we will examine three things. We will examine the position of the trachea. This is the first thing. We will examine the what's called cricoid notch distance. من اسمها نجي عليها، يعني اللي هي ايش بالcricoid notch؟ cricoid cartilage. والnotch يعني suprasternal notch. cricoid notch distance. And also we will examine for the tracheal tag. Regarding the examination of the trachea, position of the trachea, we will examine it in this way. We will use the ring finger and the index finger, and higher ring finger, high index. I will put them on the heads of the clavicle, and I will use the middle finger to check for the position of the trachea. I'll try to palpate the trachea itself, and then check the distance between the trachea and the muscle tendon on each side, and see whether this distance is equal or there is a gross deviation of the trachea to one side. أنا أستخدم هاي الطريقة لشعور بالصورة هوني، اللي هي using the ring finger and the index and fix them on the heads of the clavicle, and use the middle finger to palpate for the trachea and check the site of it. Or I can use my index finger alone. جائز إنه بس أستخدم الإندكس، أجي أشوف المسافة مع التراكيا عن neighboring tendon of muscle، وأشوف whether it is central or deviated grossly to one side. المهم الفكرة أنه you use the same finger, okay, to check the position of the trachea. لا أحد يستخدم طريقة خافتوش أو مثلا فيديو شيء، أكو يستخدمون thumb and index. يجيب thumb and index يشيك التراكيا، okay, whether it is central or deviated. هون هذا ممكن ينطيني فد يعني misinterpretation of the finding، يعني you are using two different fingers. فالفكرة إنه استخدم the same finger، إما استخدم middle finger أو the index finger alone. The normal side of the trachea, it's either central or it's slightly deviated to the right. ولهذا لما أستخدم التعبير abnormal أقول there is gross deviation of the trachea، يعني شيء كلش واضح، أو overt deviation of the trachea. Regarding the lesions that can lead to deviation of the trachea to one side, generally we can divide them into two types. We have what's called the pushing lesions and the pulling lesions. ايش اقصد بها؟ هسه أنتم حطوا شو عنصرها هاي قدامكم. هسه السهم هوني is on the right side of the patient. الكرسر المؤشر هوني on the right side of the patient. واضح عندكم غير؟ زين. هذا on the right side of the patient. إذا كان عندي in the right side of the patient something that is occupying the hemithorax، يعني عندي فد شيء انشال مساء الحجم هناك بالجهة اليمنى، كأن يكون مثلا effusion pleural effusion اللي هو collection of fluid in the pleural cavity, especially if I have moderate or severe pleural effusion. Oh, I have excess air in the pleural cavity, like in pneumothorax, like simple pneumothorax أو ممكن tension pneumothorax. So here these lesions might push the mediastinum, including the trachea, to the opposite side. يعني أنا أفكر إذا هون عندي فلويد كثير إيش راح يعمل أو هو راح يدفع الميدياستينم بشكل عام ومن ضمن التراكيا to the left side. هون إيش لما أجي أفحص هذا البيشنت إيش أجي أشوف التراكيا is deviated to the left. فلما أحاول أدخل إصبعي بين التراكيا وبين الليفت مصل أشوف إنه إما كلش إنه بصعوبة أو sometimes it is يعني just close to the muscle that you cannot put your finger in between. بينما أجي مثلا على الرايت أشوف إنه كلش المسافة كبيرة. فهوني deviation of the trachea to the left صار نتيجة إيش؟ صار نتيجة pulling عفوا صار نتيجة pushing effect from the right side. أوكي؟ نفسه هذا البيشنت إذا أجي أخذ الإكزامبل نفسه إنه trachea it's grossly deviated to the left. يعني هوني ما قدر أدخل إيدي. قدنا ممكن يكون pushing from the right to the left أو عندي lesions in the left that is pulling the trachea. فالpulling lesions أكثر شيء عندي شنو؟ collapse. Okay, collapse of يعني either of the whole lung or collapse of a lobe. This will pull the trachea to the affected side. Also the fibrosis, especially when I have يعني dense fibrosis. fibrosis تكون دائما يعني مثلا أي واحد بيكون مثلا عنده scar يشعر إنه يعني tissue in the scar is tight، حتى the يعني neighboring skin شوف شوية tight. ليش؟ الفايبرس tissue يعني يسحب. فنفس الشيء هون إذا كان عندي the fibrotic lesion in the left it will pull the mediastinum including the trachea طبعا to the left side. الفكرة أنه when I have deviation of the trachea it might be a pushing lesion or a pulling lesion. Pulling يسحب to the same side. Pushing يدفع to the opposite side. واضح؟ Anything to examine in the chest. قلنا cricoid notch. هاي ايش الcricoid notch distance؟ قلنا اللي هي المسافة between the cricoid cartilage and the suprasternal notch. شلون ألقي أنا الكريكويد cartilage؟ أنا أبدي I will start to palpate in the midline from the chin. من الchin. نعم. أوكي. I will start to palpate in the midline from the chin downward. يعني أبدي من هوني أعمل palpation with one finger. أول cartilage اللي يجيني هوني هذا إما cartilage. This is the thyroid cartilage. Okay, this is the thyroid cartilage. I keep doing the palpation. After the thyroid cartilage, there comes a small dip. هكا تجيني فتفت خسفة صغيرة. اللي هي إيشنو هذا الخسفة الصغيرة؟ This is the cricothyroid membrane. يعني few millimeters. يعني قد أحس يعني تقريبا 3 millimeters 4 هكذا ما أكثر. على قد ما واحد يعني أنا بقي يعني الأصبع من الشين أمشيها على midline. أول كارتلج هذا الثايرويد أبقي إيدي أظل بالبالبيشن وأحس فد ديب. أوكي فتخس فيها كذا صغيرة. هذا الكريكوثايرويد ممبرين. الكارتلج اللي يجيني بعد هذا الديب هو هذا الكريكويد كارتلج. واضح؟ فمن اسمه كريكويد نوتش ديستنس. أجي أقيس المسافة بين الكريكويد كارتلج اللي لقيتونه وبين السوبراسترنال نوتش. رفعي هي تقريبا 3 fingers. هاي المسافة. إذا كانت عندي أقل less than 3 fingers, this is a feature of hyperinflation of the chest. يعني hyperinflation of the chest كنصعد. فأشوف إنه المسافة هاي بين الكريكويد كارتلج بين السوبراسترنال نوتش قلت. وهذا يعطيني clue that there is hyperinflation of the chest. The other test is for the tracheal tug. The tracheal tug is again a sign of hyperinflation of the chest. هذا صار عندي cricoid notch distance and tracheal tug. إيش هو tracheal tug؟ هسه أي واحد بيكم جربوها هسه جربوا خلوا 3 fingers نفس اللي نستخدمها index و middle and ring finger tips of fingers خلوها over the trachea and take a deep breath. يعني breathe in and breathe out. راح تحسون انه you will feel the movement of the trachea on your fingers and it's a slow movement. جربوها ستة. أخلي 3 fingers over the trachea. Breathe in and breathe out. You will feel that there is a simple movement of the trachea. You can feel it with your fingers. هذا normal. In tracheal tug, you will, when you put your fingers on the trachea and ask the patient to breathe, you will feel a rapid descent of the trachea downward. يعني تشعروا لأنه هكذا في شيء يزلق على السريع ينزل جوا. Slip down of the trachea. This is called tracheal tug and it's a feature of hyperinflation of the chest. هسه هاي الخطوة. هسه قلنا بالنسبة للتراكيا position of the trachea, cricoid notch distance, and tracheal tug. Regarding the palpation of the chest, the next step is the expansion. In expansion, مثل ما عمل بالصورة هوني, here you will put your hands on each side of the chest and make your thumbs meet at the midline. here, when you put your hands on the chest, try to spread your fingers along the intercostal spaces. يعني لا تخلون ايدكم مطبوقة طبق الأصابع. افتحوا الأصابع بحيث أنه تقريبا تمتد فوق الانتركوستال سبيس. قلنا بالنسبة يعني الهاند جريب لا تكون كلش تايت اوفر ذا تشيست بحيث يعني راح تعيقون التنفس مع البيشنت، ولا تخلوها هكذا طايفي. You just put it on the chest and spread your fingers along the intercostal spaces يعني in a moderate force. يعني try to make your hand as part of his chest. لا أنه كلش تعيقه ولا أنه تخليها طايفي الإيد. And make your thumbs meet in the midline. الثمز يسوون قريبين واحد عن الآخر. Level that we do the expansion in males, it's easier. It's just below the nipples. So when your thumbs are close to each other in the midline, ask the patient to take a deep breath. You can see that with breathing, هسه مثل ما مبين بالصورة كان ابتعدوا thumbs from each other. يعني وقت اللي أخذ النفس صار عندي expansion of the chest فابتعدوا thumbs from each other. هاي المسافة اللي صار بيها التباعد هي هاي the expansion of the chest. فأنا إما أقدرها تقدير أو الأفضل إنه يكون عندي tape measure. أجي أقيس إيش قد صار ال expansion of the chest. عندكم فكرة عن ال chest expansion إيش قد النورمال؟ ما عندكم فكرة؟ وعادة الإكسبانشن نقول عليه نورمال هو يكون 5. 3 to 5 هذا يعني خلينا نقول عليها can be يعني sometimes considered as normal if there is no other abnormal finding. لكن لما يكون عندي less than 3 cm this is definitely reduced. فإذا كان less than 3 cm of expansion, this is definitely reduced expansion of the chest. أنا بالحقيقة لما يعني أبحث for the expansion of the chest ما بس يهمني أنه أشوف ال total expansion إيش قد كان. I should also notice from the movement of my hands, I should also notice whether the expansion was symmetrical or not. يعني أشوف هل أنه إيدي اليمين واليسار حركوا نفس يعني مسافة تقريبا إلا كان أكو فرق. مثل ما تذكرون inspection and look at the movement of the chest and whether it's symmetrical or not. هوني بالexpansion هم لازم أتأكد من هاي النقطة. يعني إذا inspection لاحظتوا أنه there is an asymmetry in the chest movement بحيث أنه مثلا يقول in the right side it was a bit less than the left. ممكن بالpalpation يعني أجي إما to confirm أو to يعني abolish this finding. إما أتأكد فعلا أنه فعلا بالرايت هو أقل من الليفت أو ممكن لا بالعكس أنه يطلع عندي normal و symmetrical expansion حتى ألغي هذاك الاحتمال. ممكن مرات يصير عندكم حالة أنه تقيسون total expansion of the chest ممكن مثلا يطلع عندكم 4 أو 5 cm. لكن من تجون مثلا تقيسون القياس تشوفون أنه هاي 4 أو 5 cm ممكن منه مثلا هو يكون 4 cm من الليفت تحرك والرايت تحرك بس 1 cm. ولهذا التوتال يعني it's not accurate enough. should also consider about the symmetry. The expansion of the chest, it can be decreased in many cases. Either you might have a diffusely decreased expansion، يعني هذا اللي راح يكون all over the chest، أو it's an asymmetrical expansion بحيث إنه هو it's affected in one side which affects the total expansion of the chest. فبالنسبة خلينا نقول إذا كان عندي diffusely reduced chest expansion، عندي many causes. ممكن يكون in case of emphysema، يعني in COPD that's advanced. ممكن يكون عندي مثلا due to pulmonary fibrosis. okay. ممكن يكون bilateral pleural effusion. ممكن يكون عندي فد musculoskeletal disease which affecting the breathing of the patient. Pneumonia sometimes. يعني many causes. ممكن يكون عندي مثل ما قلت reduced expansion in one side of the chest which is affecting the total. فممكن انه مثلا يكون عندي فد lesion in the right بحيث انه يطلع total expansion of the chest مثلا 3، لانه مثلا ممكن الرايت سايد ما تتحرك نهائي على سبيل المثال. فممكن يكون عندي either reduced يعني expansion due to collapse, pneumonia, lobar, pneumonia, pleural effusion. Patient who have had a lobectomy or pneumonectomy, removed excised either a total lung or part of it. هكذا ممكن أن تكون causes. كذلك مثلا pneumothorax هو قلنا يعني air in the pleural cavity. This will compress the lung. Then this will compress the lung and will affect the expansion also. But this is in regard to the chest expansion. The other thing to examine in the chest is the apex beat. apex beat هاي إن شاء الله راح تأخذوه بالكارديوفاسكولار سيستم، بس احنا حتى يكون عندنا يعني واضحة شنو الأبيكس beat. Apex beat, it is the lowermost and outermost maximal point of pulsation in the chest. أجي أنا يعني أخلي my right hand خلينا نقول at the level of the fifth space and try to look for the apex. ممكن أنه أنا أحس the pulsation in many sites in the chest. لكن I'll try to look for the most inferior and the most lateral pulsation. This is the apex beat. It represents the mitral area. So when you find the apex, try to locate it by one finger. أنا أدور على الأبيكس أحس البلسيشن، بعدين يعني أحدد المكان، أحاول أحدده locate the apex. طبعا keep your finger at the same side that you found the apex. إما تبقي الإصبع بنفس المكان اللي لقيت به الأبيكس، or you can use a marker pen to mark the area. أو يعني نأخذ رخصة من المريض نستخدم في قلم ماركر عن نقطة بالمكان اللي لقينا به الأبيكس. And now try to locate the exact position of the apex. لازم أنا لما ألاقي الأبيكس لازم أبدي أنه أحسب المكان معه. فأشون أحسب يعني the site of the apex. according to the sternal angle. تعرفوا sternal angle or angle of Lewis اللي هي opposite to the second intercostal space. فأبدي أنه I'll start using my left hand and I'll start to calculate the intercostal spaces. أجي من sternal angle هذا second space أنزل space واحد هذا third space واحد هذا fourth space fifth. Usually the apex is located in the fifth intercostal space within 1 cm of the mid-clavicular line. يعني قد يكون on the line itself, on the mid-clavicular line, 1 cm medial, 1 cm lateral. This is the normal site of the apex. ليش احنا نفحص apex in the setting of examination of the chest? Because some respiratory diseases can lead to deviation of the apex. مثل ما شرحنا قبل شوية قلنا we have pushing lesions. Okay. مثلا قلنا إذا كان fluid, pleural effusion or air in pneumothorax, it will push the mediastinum to the opposite side. الميدياستينم طبعا من ضمنه الهارت. If you have, like we say, moderate or severe pleural effusion in the right side, this will push the mediastinum to the left. So you will have trachea that is shifted to the left, and you have apex beat that is deviated to the left. فممكن إنه هون أشوف apex. It is in the fifth intercostal space, لكن it is مثلا 2 or 3 cm lateral to the mid-clavicular line. The other thing that we will discuss in the palpation of the chest is the lymph node examination. You know the groups of the lymph nodes. We have groups in the head and neck. We have the axillary lymph nodes and others. Here we will concentrate about the cervical lymph nodes, supraclavicular and scalene lymph nodes, and the axillary lymph nodes. Lymph nodes should be examined in the setting of respiratory or in the setting of the chest examination. We said mainly we'll concentrate about the cervical lymph nodes, anterior and posterior cervical lymph nodes. We'll also examine the scalene and supraclavicular lymph nodes and the axillary. Many types of diseases can lead to lymph adenopathy, like the infectious diseases, inflammatory diseases, and also in malignancies. Okay, when you face an enlarged lymph node, we should comment on certain things. You should comment on the site where you find the enlarged node. Okay, it's either in the cervical, in the axillary, or in other site. So decide the number of the lymph nodes, whether it's one or it's more than one. The size of the lymph nodes, because sometimes the size matters also. If you find a small lymph node, let's say of half cm or 1 cm, might be due to an irrelevant cause. But finding a large lymph node that's 2 cm or more, this should be considered serious. So the site, the size, number, and when you have multiple lymph nodes, you should comment whether they are discrete lymph nodes مفصولة عن بعض البعض or they are matted. يعني بيلتصق nodes في Matted lymph nodes can occur in the setting of tuberculosis and also in malignancy. Also should comment about the texture of the lymph node, whether it is soft, whether it is firm, whether it is hard. Soft lymph nodes usually occur in the setting of an infectious process. Firm lymph nodes, called rubbery also, they can occur in some cases, but the most famous example is the lymphoma. And lastly, the hard lymph nodes, those are typical of malignancy. التشبيه ماذا يقولون soft like a lip, firm like a nose, and hard like a bone. This is in regard to the lymph nodes. Other diseases will sarcoidosis, you will have lymph adenopathy. Last thing in the palpation of the chest, it's the tactile vocal fremitus. Tactile, أي شيء tactile معناته تلامس. Here in the tactile vocal fremitus, you will you'll put your hands, okay, and especially the ulnar side of the hands over the chest, okay, in many sides, starting from up and middle and lower zones. And you will ask the patient to say certain things. Either you will ask him to say 99 أو بالعربي نقول 44. Here, while you are putting your hands on the patient's chest, you will measure the transmission of sound from the lung to the chest wall. This will be reflected as vibration. أي واحد فيكم لمن يخلي إيده على صدره ويحكي أحس إنه أكو نوع من ال vibration يصير. فإحنا نقول له للبيشنت قول 44. هذا tactile vocal fremitus. بالحقيقة ما كثير نركز عليه لأنه equivalent to the tactile vocal fremitus اللي هو step in the palpation, its equivalent in auscultation is the vocal resonance. وبالحقيقة the vocal resonance is more reliable and accurate. So that's why